Hello. Hi, good morning. This is Dr. Verma from here at Lifestyle Physicians in Warrenton. Um, this is our third series with Dr. Cope. And as I had introduced you before, Dr. Cope is the naturopathic physician who has joined Lifestyle Physicians and is a specialist in PCOS, PMS, and fertility. She's a naturopathic doctor licensed in the state of Oregon. She's moved here to Richmond and she has helped numerous patients with their PCOS, PMS, and last week she told me that she has treated 42 patients with infertility and she had 100% success rate. Me not being a specialist in infertility, don't know much about it, but of course I'm going to ask her questions as a layperson, and if anyone else and any of you have questions, then you can definitely ask us. I think this is an amazing she's an amazing gift to our community here. Numerous people suffer from PCOS, PMS. They don't know what to do about it. They get put on birth control pills and they get put on antidepressants. It's a very those few days are very difficult, and it can really ruin your life. You can't get out, you can't work, and there are different ways to treat them. I mean, you don't have to take contraceptives. You don't have to stop having periods. So there are different ways to treat them, and we had discussed about this last time, and we're going to talk about PCOS again next time. But today the topic is going to be about infertility, and like I told you, she has an excellent success rate with infertility treatment in a naturopathic way. So now on to Dr. Cope. So tell us something about like how do you treat?
How do I approach it?
How do you approach it? What are your typical? First of all, what is? We all know what infertility is, but what is your typical patient who you've been seeing, like who comes to you for help?
Yeah, so clinical infertility is if you've been trying to conceive for a year and you've either had multiple miscarriages or else that you just simply haven't gotten pregnant. And generally it's either people that are coming in that are 36 or 37 and they're not quite sure how to begin optimizing their egg health in order to make sure that when they start conceiving that they don't have a miscarriage and have to wait a couple of months. And then also I started in infertility when I started treating PCOS because a lot of women have issues having a true ovulation or even knowing if they're ovulating. And so I started with infertility with a lot of PCOS patients that I treated successfully, and then they wanted to get pregnant and making sure that they have a true ovulation in the middle of their cycle.
So, so in naturopathic medicine, how do you get trained in infertility? Like, is there special courses?
There's special courses. I love Dr. Chassie, Dr. Jacqueline Chassie, and I've also taken courses with Veram. Do you know Veram? She's the MD in women's health, and she's absolutely amazing. I think she's also a midwife. And so you just start looking around, and there's lots in Chinese medicine with infertility, and I've taken a couple of those courses too.
Okay. So when the patients, like, how do they find you?
How do they find me? Generally looking up, like trying to get pregnant and just starting to search down. I have a couple of herbal products that I've come out with, and patients started to find me through that. But generally just starting to look up and research and ask around. Word of mouth is the best. Okay. And so in Richmond, I've become pretty well known for it.
Yeah. Oh, good. Yeah. Okay. Yeah. And so, tell us the whole process. How does the patient come to you? What do you do? What should they expect on their first visit?
Yeah. Well, most commonly when people are coming in, I ask for people to start tracking their cycles, and anybody that's had issues with their period, you go on and you look and you try to download a cycle tracking app, and it's really confusing because they have ovulation predictors that are off in the cycle tracking. So sometimes it's as simple that people don't even know how to tell if they're ovulating. And that is, it's a three-legged stool that you can look at your LH strips from like day 10 to 15 or 17 of your period, and those are strips that you can get at any drugstore and urinate on, and you check for cervical mucus to make sure that it's egg white, and then also you're taking your temperature every single morning with a specific thermometer for fertility, and your temperature spikes up after you've ovulated, and you actually want to be having sex for about 5 days every other day for the sperm to be concentrated. And when you do, and you want the sperm to already be in your uterus by the time that you're ovulating, so then that way it can make it to the fallopian tubes and then travel back down for implantation. And so often it's just a simple timing. And so I've written lots of articles on that and tried to educate people before that they even try to seek help and help for it.
That's good.
Yeah.
So how long does a patient normally stay with you, like for the fertility?
It's generally about a year, and this is because not necessarily, sometimes it just takes like 2 or 3 months to get pregnant once you start taking supplements and optimizing your health and getting rid of pesticides and anything that could be interfering with fertility. But what the studies show is that miscarriages, which every single woman almost that I've seen that's tried to get pregnant has experienced a miscarriage. I think they say the rate is about 30% for miscarriages. And if you're working on stress and lifestyle, the chances of you holding a pregnancy to birth increases by like 34% just simply with support from a doctor. And this was done on research with a nurse practitioner she offered kind of like a membership style like both of us that do, and met with her patients once a week and was just simply checking in with them and seeing how she can best support them through their pregnancy. And all the patients in that IVF clinic ended up having a healthy conception. The ones without that weekly support ended up miscarrying. And so it's
Wow.
yeah.
That's really true. I mean, so a typical IVF, if you're doing ICSI or something like, it's like $25,000, not covered by insurance, things like that. And of course, you've got to give yourself injections and progesterone and all that, daily injections for 40 days, 80 days, things like that. So if there are ways that you can be helped naturally, I think it's worth giving a try. So what do you do? Like what do you do with the patients? Like when they come to you, you do blood tests and everything.
Yeah, do blood tests and blood workup. A common cause that all of us see with infertility is thyroid. And when you ask for a thyroid test, people generally just look at TSH, which is the pituitary's response to the thyroid. But if you look at the actual thyroid level, and so you look at free T3, that may be up or down. But what's very commonly associated with miscarriages and infertility is the thyroid antibodies. And that's not commonly checked for unless you're having the classic Hashimoto symptoms, such as losing hair and dry skin and fatigue and constipation. And so just looking at thyroid antibodies is really, really big. Also, just looking at the general oxidative stress on our patients, because oxidative stress on males and females, and more so affects actually the sperm than the egg health. And so about 30% of infertility is due to the male sperm morphology, or the way that it can swim straight and fast straight to the uterus. And then 30% can be due to female, and then 30% is unknown, and the other 10%, I'm not sure where they calculated that. And so you want to really look into supplementing with antioxidants. There's not a male prenatal. There are plenty of female prenatals, but there's not a male one, and a lot of the female prenatals don't include CoQ10 as a very healthy antioxidant, or N-acetylcysteine, or fish oil. And so you have to add in all of those types of supplements, and often I've seen when people just change their diet and start having the orange and the red foods that have a lot of the antioxidants that we're supplementing for, they get pregnant.
Oh, good.
Yeah.
So out of the 42 patients that you said, you
Mhm.
all of them got pregnant, which one do you remember stands out the most? Like, give us an example.
There was
You don't need to
I
take
get
names.
yeah. I it's funny, I was just talking with Dr. Chassie, that's one of my mentors. I was like, do you still cry every time you think about your patients getting pregnant? And she does. And she's been doing this for 12 years. But there's this one patient, she was meant to have her uterus out. And she came to me and she said, they're talking about, this is my last straw. They're talking about taking my uterus. Now I'm looking into adoption. What do I do? And so we treated her PCOS for a good 6 or 7 months. And she said, okay, I'm ready to try. And so we started we did the Mercier series, and we started, she did have one miscarriage and then waited 2 months, and then she had a positive pregnancy, and now I believe she has 3 or 4 children, and she tried with each one. So going from having to get uterus out to conceiving, which is...
It's amazing.
Yeah.
Okay. So I think in parting, it's a blessing that we have in our area, in our clinic. We have Dr. Cope here. And I'm sure as time passes by, we'll have more and more patients inquiring, and we are here to support you. We want to thank all the patients who've been with us before and who still come to us, and Dr. Saad is here. So I think we're going to make a great team, and hopefully in the near future provide you with excellent integrative medicine services. Thank you for anyone who was watching, and if you have questions, do let us know. You can call us at 540-680-2426 or go to our website. Thank you. Have a good day. Bye-bye.